For this final closing session of today, it's my pleasure to welcome back Neil Johnson, the founder and executive director of the Global Heart Hub. Neil, I know you've been watching and listening very carefully all afternoon. What are your key takeaways from both the session on COVID-19 and indeed this last session on the power of the patient's voice?
Thanks so much, Nicola. And I hope people got as much from these two sessions as I have. Looking back over the first session, where we were really keen to explore lessons learned on the role of the patient, I took a few notes here. First of all, in terms of Professor Ferrari's opening presentation, I think he actually confirmed through his slides that possibly one of the most powerful messages, public health messages of all time during COVID, to stay at home, actually delivered unintended consequences. And in fact, that very much aligns with why the Global Heart Hub developed and delivered that Just Go campaign that Kelsey made reference to, because we actually saw that there was such a level of fear and anxiety across the world around COVID, and particularly the messaging which suggested that those living with cardiovascular conditions were most vulnerable, actually led people to freeze literally in their homes, and many died as a result of that. So I think that was an important sort of reaffirmation of how powerful that message was and what we must learn from it. Because clearly this is not something, should we be facing pandemics in the future, this is not something we want to see happening again. And therefore those developing these messages, the public health specialists who develop these messages, need to consider the behavioral implications of that type of messaging. He also said something which I thought was quite interesting, and he was comparing COVID with the coronavirus, and he was saying, cardiovascular disease is accepted and expected. And actually that taps into something which will be addressed tomorrow in tomorrow's session, where we're going to be looking at ASCVD, because I actually believe that we talk about cardiovascular disease with some level of complacency. And I think that's the complacency that he's referring to today. He's saying we have CVD with us for so many years, generations, in fact, and we've sort of come to accept it. But actually within the umbrella of CVD, there is one component of that known as ASCVD. And ASCVD is that, if you like, that's the cancer of our disease area, because it's that insidious, slow burning part of cardiovascular disease that actually causes the greatest toll and takes the most number of lives. And then from Alex, we went into the bladder cancer community. And again, it was just interesting to see what the cancer coalition that he put together and came together for was around COVID. And that in his research, he found that only 1 in 4 of the patient groups were involved in any formal consultation. So clearly, again, going back to that public health messaging, the knee-jerk reaction to COVID, system shut down, lack of consultation with patients, and the people who suffered most were actually patients. And obviously today we're talking about CVD patients, and so we know more than most just how they suffered. And it was really a case of the patient being left outside. And literally outside, as we know, in some cases, as we've seen images from around the world, where patients were looking in the windows of hospitals to try and see their loved ones. And Juan talked about only 12% of the patient groups represented within, I think 12% within the countries. And again, the same thing, confirming that there was a very poor lack of consultation and engagement. But he did highlight 2 priorities, I think, and one was digitalization, which I think is very important, and it's definitely the way forward in terms of how patients engage with health systems, not just in pandemic times, but in general. And also his message about prioritizing chronic disease and patients with chronic disease. And again, there's a strong message in that, because it's not just about acute care. Acute care is definitely something, but we obviously need to address those living with chronic diseases. Durhain, of course, made a very strong and useful comparison to the rare disease community. And we should take real encouragement from this, because when you consider that rare diseases are, as the name suggests, rare, and yet the rare disease community is able to have such a strong voice, then us in the cardiovascular community, which is a much bigger condition, we should be able to draw strength from our number and really develop a strong voice. And finally, Anselm, and I really was interested in a number of the points he made. I thought it was quite interesting. He showed in his research that 79 to 81% across countries preserved acute coronary syndrome services. And that could be taken as a sort of a positive, but also a negative. A positive, of course, that acute services didn't completely shut down for the real acute MIs and so forth. But I think it does hide the fact that it was just the acute services that were really benefiting from the the access point of view, whereas it was the chronic conditions and those that could afford to wait were left waiting. But he also raised a very important point about how the commercial world actually rather sinisterly perhaps made a benefit of the fact that people were staying at home, locked down, and so we had greater consumption of junk food and alcohol and so forth. So overall, I think some really powerful messages and in terms of reflections and learnings from that COVID period.
Yeah, I would fully agree there. I would fully agree. Thanks, Neil. Maybe we can just quickly look at some of the contributions to the Just One Thing. The first one we got was to tackle or improve inequalities in healthcare. Acknowledging there is a problem is the very first step, and I think that's really important. Another contribution is I'd like the Global Heart Hub to focus on mental and emotional health linked to CVD. Other organisations are working on it, but a joint approach would be great. Another, we the patients play a huge part in our own health advocacy. As Doreen said, you only fool me once, and let's go back smarter. Another, I'm inspired by the global response to patient advocacy. I applaud any attempt to ensure patients are considered a major stakeholder at all levels, policy, prevention, care and research. So a lot of really positive and interesting input here. And if we look back at the poll that we did at the beginning of the meeting, which highlighted 100% that the global CV community can indeed be more vocal about its needs and rights. I think today's session has really helped to advance this conversation, demonstrating how communities can unite. And the title, of course, of this summit is Unite. So lots and lots of food for thought. Thank you very much, Neil, for your input today, but of course your thoughtful leadership that has enabled the Global Heart Hub to flourish. And thanks to all of the speakers and panelists in this first day of the summit. We really appreciated all of your contributions and those, of course, from you as the participants, all your input to the chat, your Q&A, your input also to the Just One Thing. Fantastic. And we have a great lineup for tomorrow. We have a Meet the Expert session, which will enable you to talk to leaders in your specific area of interest. And Neil's already mentioned the ASCVD session. There's also a session on heart valve disease and heart failure. So lots and lots of interesting discussion there. And we'll break up into parallel sessions. But there'll be another very in-depth session looking at the technological transformation in health, which we've touched upon today, and implications for this community, of which there are a great deal. Also looking at that whole health data piece. Until then, please do continue to add your thoughts to the Just One Thing tab. Continue to talk about the summit on social media. There's a lot of action on Twitter right now that I'm following using the hashtag GHUnite ! And check in on the resources and materials and all of the topics that we're exploring in the summit. There's really some fantastic, a wealth of material. The recordings and PowerPoints will be available on the Summit platform very soon, so keep an eye out for that. And with that, I wish you all a very, very nice rest of the day, evening, and look forward to seeing you tomorrow for some more dialogue and learning that supports the strengthening of the CV community across the globe. Thank you very much once again, and goodbye. Have a great evening and day. And thanks again to you, Neil.
Thank you, Nicola, and spot on time. Thanks so much for your excellent stewardship of today. It was really great having you. And of course to Kelsey and all the team at the Good Lobby, thank you for that last session with all those tips and advice which we will definitely take on board. Take care, everybody.